who had a positive impact on the world through education, research, or service. As members of the RCSI community, we believe our graduates too hold the same potential, and we want to encourage and inspire you on this your special day to go forward and make a difference. Today we award the award of Honorary Doctorate upon Dr. Tait Shanafelt, Chief Wellness Officer at Stanford Medicine, Director of WellMed and Well PhD Center at Stanford Medicine, the University of Stanford. I'm delighted to invite the 2026 Honorary Doctorate recipient, Dr. Tait Shanafelt, to take his place on the stage. And it gives me pleasure to invite Professor Tracy Robson, Deputy Vice Chancellor of RCSI, to deliver the citation for Dr. Shanafelt.
President, it is with great pleasure that I introduce our candidate for the RCSI Honorary Doctorate Award, Dr. Tait Shanafelt. Dr. Tait Shanafelt is a Chief Wellness Officer, Associate Dean, and the Jeanie and Stewart Richie Professor of Medicine at Stanford University. He is a physician scientist and hematologist oncologist with a clinical focus on chronic lymphocytic leukemia and a pioneer of modern physician well-being research. Over 25 years ago, at a time when burnout was viewed as an individual failing, Dr. Shanafelt's research produced the first rigorous large-scale evidence demonstrating its systemic nature and its profound implications for patient safety, professionalism, workforce sustainability, and organizational performance. Through landmark studies in the United States encompassing physicians, surgeons, oncologists, and medical students, residents, and nurses, he generated the data that compelled institutions to act, moving clinician well-being from the margins to the strategic priorities of healthcare leadership worldwide. His work has transformed our global understanding of clinician well-being. Dr. Shanafelt has published hundreds of peer-reviewed papers on clinician well-being, including foundational work in JAMA, Annals of Internal Medicine and Mayo Clinical Proceedings. His co-creation and validation of the Wellbeing Index, now used by over 1,000 healthcare organizations and tens of thousands of clinicians across the world, has provided health systems with reliable tools to understand and address well-being and professional fulfillment. His research also established a direct link between leadership behaviors and staff well-being, demonstrating that the everyday actions of those who lead clinical teams can greatly shape engagement and professional fulfillment. This work reframed leadership development in healthcare globally and has been integrated into national strategies, hospital governance frameworks, and professional training programs. Dr. Shanafelt's influence extends far beyond academia. He has served on multiple committees of the National Academy of Medicine, where he co-led the national strategy to address clinician burnout, an initiative that now guides health systems throughout the United States. The Well MD and Well PhD Center he leads has trained more than 280 deans, chief medical officers, and other executive leaders from around the world how to advance clinician well-being through their Chief Wellness Officer training program. The Centre has also trained over 1,700 departmental leaders from 38 countries through their Department Wellbeing Director course. He has advised governments, professional bodies, and hundreds of hospitals internationally, helping them develop evidence-based organizational approaches to improve the daily lived experience of clinicians. His contributions have been recognized at the very highest level. In 2018, Time magazine named him one of the 50 most influential people in healthcare. While best known for his leadership in well-being, Dr. Shanafelt also maintains an internationally respected career in hematology and chronic lymphocytic leukemia research, leading NIH-funded programs and landmark clinical trials, making major contributions to the understanding of prognostic markers, therapeutic outcomes, and disease biology. His dual impact, advancing both cancer care and the care of clinicians themselves, is unique in contemporary medicine. Dr. Shanafelt embodies the values at the heart of RCSI's mission to educate, nurture, and discover for the benefit of human health. His work has elevated the global conversation on the humanity of medical practice, reminding us that caring for those who care for others is essential to delivering safe, compassionate, and sustainable healthcare. Tait, it is an honour to welcome you to RCSI today. Your scholarship, leadership, and unwavering commitment to the well-being of clinicians worldwide have had an extraordinary and enduring impact on the profession of medicine and will continue to do so for generations to come. In recognising your achievements, we also affirm a simple but vital truth that your work has brought to the forefront of our profession, that the care of patients is inseparable from the care of those who serve them. We are proud to confer upon you the highest academic award at the Royal College of Surgeons in Ireland, the Honorary Doctorate in Science. I now call on the President of the Royal College of Surgeons in Ireland to make the award.
By virtue of my office of President, it gives me great pleasure to award you with the Honorary Doctorate of the Royal College of Surgeons in Ireland.
Now gives, thank you. It now gives me great pleasure to invite our 2026 RCSI Honorary Doctorate recipient, Dr. Tait Shanafelt, to address us.
Thank you. To the graduates, congratulations. It's an honor to join you today, together with your families, friends, mentors, and faculty, to celebrate this remarkable milestone in your professional journey. Medicine is a noble profession, grounded in service to others and advancement and application of knowledge to foster human health. As an oncologist, I can think of no more meaningful way to spend one's life. Studies tell us that more than 90% of doctors experience their work as a calling, rather than simply a career or job that provides a paycheck. At this point in your training, I suspect many of you are also interested in that first paycheck. But I hope that, above all, you sense that experience of calling today and recognize that the work you are entering into matters deeply. After 25 years of studying the professional life experience of physicians and surgeons, I'd like to share a few reflections with you. First, there are occupational risks to our profession. Because the work we do is important and the needs of those we serve great, it can be difficult to establish healthy boundaries. Without intention, the work can consume us. Occupational burnout, moral injury, challenges with work-life integration are not abstract concepts. They are realities experienced by most physicians at some point in their career. Extensive research demonstrates that these forms of distress affect not only our well-being, but also the quality of care we provide, the compassion we extend to our patients, and the longevity we have in the profession. Many factors contribute to these challenges, and most originate in the practice environment itself. Inefficient systems, staffing shortages, diminished agency, poor teamwork, and suboptimal leadership behaviors, to name a few. Addressing these challenges requires organizational commitment, and fortunately, a number of vanguard institutions have begun this work. But today, I'd like to focus on something different, a contributing factor each of us carries within ourselves. Even if I had a magic wand and could solve every problem in the healthcare environment tomorrow, we would still struggle because of some of the professional norms and mindsets we internalize along the way. Although medical students begin training with lower rates of burnout and depression and higher emotional quality of life than peers entering other professions, that profile reverses during medical school and often worsens during internship and specialist training. As a profession, we are exceptionally good at finding and solving problems. We defer gratification. We strive to constantly do more and serve more. We hold ourselves to exacting standards. We project strength around colleagues and often keep our struggles private. We learn to act as though we are impervious to fatigue, loss, uncertainty, and our own humanity. These qualities serve us well in many ways. They make us skilled diagnosticians. They allow us to endure the rigor of training and to place patient needs before our own. They nurture dedication and inspire excellence in care. But each of these virtues can have a shadow. Our ability to defer gratification can become neglect of self-care and the relationships that sustain us. Our talent for identifying problems can foster a deficit-focused orientation to our lives. My patients appreciate that quality more than my wife and children do. Our drive to achieve can crowd out the people and experiences that give life meaning. Although we are compassionate with others, we are often perfectionistic and unforgiving toward ourselves. And our reluctance to show vulnerability can disconnect us from one of the greatest sources of resilience we have, our colleagues. These forces take their toll. Physicians and surgeons report greater disappointment in their life accomplishments than workers in other fields, greater strain on personal relationships, higher levels of social isolation, and lower levels of self-compassion. Our research indicates that these factors are among the strongest drivers of occupational burnout and erosion of meaning in work. There is, however, a way forward. Research has shown that subtle shifts in mindset allow us to preserve the virtuous qualities of these professional norms while reducing their unintended consequences. Instead of believing any imperfection means I'm a bad doctor, we can embrace the mindset that I'm a good doctor who is learning from experience and becoming better. Rather than believing that a dedicated physician or surgeon must always put work first, we can recognize to care for patients sustainably, I must also take care of myself. Instead of defining ourselves exclusively by professional achievement, we can remember, my work is an important part of who I am, but it is not the entirety of who I am. And rather than believing doctors must always project unwavering composure and strength, we can recognize that appropriate vulnerability with colleagues fosters connection, trust, and mutual support. Lastly, take care of each other. Medicine has always been a demanding field. One of the factors that has sustained us for millennia are the extraordinary people we do the work with. Hardworking, dedicated, altruistic colleagues. We need one another. During one of the most difficult seasons in my own life, when one of my children faced a life-threatening illness, the support of colleagues reminded me that none of us are meant to do this work alone. A culture that glorifies invulnerability ultimately isolates us. We must reject the myth of solitary hero and embrace the understanding that we are human beings. That mindset allows us to be authentic with colleagues, support one another through difficulty, and receive support ourselves when we need it most. Thank you again for allowing me to join today's celebration. I congratulate you on this achievement. There are meaningful and rewarding days ahead as you apply what you have learned to serve others. I hope you will aspire to be healers, not only for your patients, but for everyone whose lives you touch. Embrace the understanding that as doctors, we are never finished products. We are always learning, growing, and becoming. Reject perfectionism while maintaining a commitment to excellence. Cultivate self-compassion. Invest in community. Allow yourself to be known by trusted colleagues and friends. If you do, you will preserve not only your effectiveness as doctors, but also your sense of meaning, connection, and calling over the arc of your career. Best wishes to you all.